Okay, so the next section that we're going to be looking at is contamination and risks from pesticides. Pesticides can be harmful if they are not handled and used correctly. This is obvious from warning signs on the label, such as toxic or irritant. The first step is to think about who might be exposed from the pesticide, such as the person applying the pesticide, other workers, anyone else near where the pesticide is used, anyone likely to enter the treated area, and anyone in contact with treated materials afterwards. So that's a sign there, just what could be on the label saying it's toxic. Absorption, so skin contact. The main way in which people are exposed to harm is through absorbing the pesticide through the skin. This happens when handling the concentrate itself, from handling contaminated equipment or exposure to spray drift. Next is inhalation, breathing in a pesticide. This is more likely to happen from approved indoor uses. If the pesticide contains a volatile active ingredient, so a volatile ingredient is one that evaporates quickly at normal temperatures. And the next one is ingestion. So if you swallow a pesticide, this can happen by putting a contaminated hand or object into the mouth. So these are just diagrams showing how you can, so inhalation, breathing it in, skin contact, cleaning your PP off with your hands, and ingestion. Okay, so this is just a quick quiz. Swallowing a pesticide, so ingestion. Breathing in is so inhalation, and the pesticide entering your body through skin contact, so absorption. Signs that someone may have been contaminated by a pesticide include headache, nausea or vomiting, stomach pain, breathing difficulties. If you or someone nearby feels unwell when you are using pesticides or afterwards, you should always follow the correct emergency procedures. Even if the product label doesn't say you need PPE, it is good practice to wear it. Wear overalls, protective gloves and boots at all times when you handle pesticides or their containers. Handle pesticides in a well-ventilated area to avoid build-up of vapours. Don't eat, drink, smoke or go to the toilet while working with pesticides. You can only do these things outside the treated area and after you have removed your PPE and wash your hands and face. Never suck or blow any nozzle, pipe connection or part of the equipment for applying pesticide. Okay, so this is just asking you to fill in the gaps with these answers below. I'm just going to skip this section. Here is what you should do if someone has been contaminated by pesticide. So stop work immediately. If necessary, call for medical help. Don't expose yourself. Wear PPE when helping a contaminated person. Move the casualty away from the source of contamination. Remove all their contaminated clothing. Wash contaminated skin or hair with plenty of clean water. If someone has swallowed a pesticide, do not make them be sick unless the label says so. If the eyes are affected, flush them with clear running water and cover with a sterile pad. Make the casualty rest and keep them warm. If you have one, take a copy of the product label with you when seeking medical help. So this is another quiz just asking you to match the two parts of each sentence. So again, I'm just going to, actually I will have a go at this. So stop, so skin or hair. Wash contaminated skin or hair. Stop work immediately. Remove exposure yourself by wearing PPE. remove their contaminated clothing, and keep the casualty warm. So we'll submit that. That's okay. If there is serious contamination, follow these procedures. If the casualty is unconscious, check their breathing and put them in a recovery position. If they are not breathing or have no pulse you are trained in first aid, begin CPR. If you use artificial respiration, make sure you use a method where you won't breathe in or swallow the pesticide. Give the doctor or hospital a copy of the product labels and materials safety data sheets. Tell them that the active ingredients and product names. Make sure the incident is reported to HSE under RIDDOR, so Reporting of Injuries, Diseases and Dangerous Occurrence Regulations. RIDDOR forms are downloadable from the HSE website. Okay, another quiz. The main way in which people become contaminated is by swallowing a pesticide, by absorbing a pesticide through the skin, from contact with other workers, by not reading the product. So it's asking the main way. So I'm going to go for absorbing the pesticide through the skin. Okay. If you need to go to the toilet or take a coffee break while using pesticides, you must clean all equipment, tell other workers, remove PPE and wash your hands and face. So I'm going to click that one, which is right. The risk of inhalation of a pesticide is greater if you are exposed to spray drift, you put your hand in your mouth, you touch contaminated equipment, you are using a pesticide indoors. So breathing it in, there's more chance if you're indoors. So I'm going to go for that one. Okay. Which of the following is not a symptom of pesticide contamination? So headache, earache, nausea and vomiting, breathing difficulties. So it's earache. When handling pesticides, to avoid contamination, you should wear PPE. Only if it says so on the label. At all times. Only if the pesticide contains a volatile ingredient. Only if you're working indoors. So I'm going to go for all times. If you are helping a contaminated person, you should wear PPE to protect yourself. Wash your hands before touching them. Dispose of pesticide before you touch them. Open a window. I'm going to go for wear PPE to protect yourself. If someone is contaminated, you should give them something to drink. Inform the environmental agency. Complete the work. Remove their contaminated clothing. So it's going to be that one. If you seek medical help, you should tell a doctor or hospital where you were working, the name of your employer, the name of the product and active ingredients, if there was a COSH assessment. So they'll need to know what chemical it is to treat them. Any incident or serious contamination must be reported to the nearest HSE office, the Environmental Agency, the National Poisons Information Service, the Department of Work and Pensions. Okay, so could be the Environment Agency. Yeah, HSE, so if you need to report it to the Health and Safety Exec. While working with pesticides, you must not talk to other workers, stop work for more than 5 minutes, eat, drink or smoke, or leave the treated area. So it's eat, drink and smoke. Okay, so that's the end of this section, so we'll move on to the next one.